A daily dose of methadone has been a constant in Leah McLeod's life for 2 decades.
That first morning when you wake up and you're not sick, that's gold.
It helped manage her heroin dependency so she could focus on living her life.
I work really hard and I'm passionate about what I do. I couldn't do that if my life wasn't stable.
Opioid replacement therapies like methadone reduce opioid cravings and withdrawals. Not just used for illicit drugs, increasingly, they're also prescribed to people who've developed a dependence to pharmaceutical opiates like OxyContin. But now some patients are waiting up to 2 years just for a prescription.
It's an extraordinary situation that for us in a first world country with such good access to healthcare, that people can't access this treatment.
There's not enough doctors that are willing to prescribe. There's not enough pharmacists that are willing to dispense.
Angelo Procolo is a pharmacist who does dispense the therapies, but he wants to be able to prescribe too.
There's a lot of pushback in Australia from the big doctor groups, and I think that is really providing a disservice to our patients.
Experts say part of the problem is that doctors who've been prescribing opioid replacement therapy for decades are retiring. And newer doctors aren't signing up because it's expensive and time-consuming. It comes as new data shows overdose deaths in Australia are being driven by prescription drugs. The report shows there were 2,220 drug-induced deaths reported in Australia in 2020, and 51% of those were due to opioid use.
That's why we actually need a national overdose prevention strategy.
Penny Timms, ABC News.